How do you know if you require an uplift with your breast enlargement surgery or not? So basically, breast uplift is for the shape. A breast uplift, a breast lift is for the shape. Implants are for the volume. So if you say to someone, what's the problem? Oh, it's the shape or the volume? Oh, it's the shape. I don't like the shape of them. Okay. Volume okay? Yeah, the volume's okay. Well, in that case, you have a lift. And if they say, well, it's actually the volume I don't like, I'm happy with the shape, I don't like the volume, implants. The problem is you don't like the shape and the volume. So if your breasts are sitting low, to a degree, implants can take up the slack and can give volume to the breast. At the ISAPS meeting next weekend, I'm giving a talk about this. But to a degree, implants can take up the slack. They don't lift your nipples. They do give projection. They don't really lift your nipples. So implants are very good at giving volume, but they're not so good at addressing the shape. So if your breasts are a little bit droopy and you have implants, they might still be a little bit droopy, but they'll be bigger. And something we can go and show you photos in the clinic to see. You might think, well, I don't want that. I don't want droopy. But I'm like, well, look, this is all photos out of a bra. In a bra, they might be fine. You might be happy with it. But you might say, look, I'm not happy with that. I don't want to be droopy. Fine, not happy with that. Fine. Then you can have a lift. The problem with the lift is it does give complications, scarring, cost, nipple problems, potentially. So there are complications associated with a lift, but it does improve the shape. Now, sometimes if people say, I'm happy with the volume, but I'm unhappy with the shape, then they can just have a lift. And I show the photos of a lift. The lift goes like that first and say, yeah, I'm happy with that. You're like, well, wait a minute. In time, gravity works on them and they settle and they get a bit less full in the upper pole. Whenever you do a lift or a reduction, it starts like that and then it settles. And it gets a little bit less full in the upper pole, a little bit empty in the upper pole. But so I don't want that. I don't want a bit, I want it full up here. And you can't really get persistent fullness in the upper pole by just doing a lift with your own breast tissue. That's when you need implants. And so sometimes people say, well, I'm happy with the volume, I'm happy with the size, because I've just said implants are good for size. Well, I'm happy with the size, but I'm not happy with the shape. But I'm also not happy with I want more fullness than the lift can give. And that's where this is what people are talking about, which is taking volume out and then replacing it with an implant to give that fullness in the upper pole. That can be done. You can do that. You can take some volume out, put some, and people do that. Put an implant in to give you fullness in the upper hole. I don't like doing it. I don't like the concept of taking away breast tissue and then you putting an implant in a prosthetic thing, a foreign body to give that shape. Although if you feel that you're really not going to be happy without that fullness up there, an implant is the best way to give you the fullness. But personally, I feel uneasy by taking breast tissue out and then replacing it with implant. So I don't particularly like it, but it is a thing that can be done. So yeah, so the hospitals were a little bit beholden to the hospitals' policies of what they say.